let's talk about the importance of temporal dynamics for automatic vessel segmentation. It goes without saying that locating blood vessels in medical images is very important and has many applications. Diagnosis of vascular disease, guidance during vascular access, and computer-assisted interventions are just three of such examples. However, most state-of-the-art techniques extract features only from static image information, and they tend to ignore the most characteristic feature of a pulsating vessel, which is its dynamic temporal behavior. Or more specifically, the temporal motion of the vascular walls, which can be detected in most dynamic imaging modalities. To address this need in MICCAI 2014, we proposed a method that can localize hidden vasculature during robotic surgery by extracting the magnitude of local motion that is in sync with the heart rate of the patient. Although successful in the context of computer-assisted surgery, when we tried to extend this method to ultrasound images, the magnitude-only approach detected false positives in regions where tissues happen to be translating synchronously with the heart rate. We thus propose a reformulation of our old approach that takes advantage of the magnitude and orientation of local motion vectors. A complete computation of local motion vectors that encodes orientation and magnitude allows us to fully model characteristic pulsatile radial distension of a blood vessel. This motion manifests as the radial expansion and contraction of the vessel walls in medical images. Unlike structures that simply translate at pulsatile frequencies, these vector fields exhibit high divergence at the center of the vessel. This phenomena can be observed when the vessel is imaged in the axial direction shown, or along the longitudinal axis. Applying our previously proposed magnitude-only segmentation method to ultrasound data results in more false positives occurring at soft tissue interfaces that are merely translating at pulsatile frequency. On the other hand, notice how the radial distension model yields the correct segmentation compared to the ground truth shown in red. We obtain drastically better results, but at the same time, the computation of full motion vectors using traditional techniques incur a great loss in computational performance. If we were to compute the motion vectors using traditional optical flow, the runtime of the algorithm would increase from 16 seconds to 14 minutes. This is not acceptable in the context of real-time guidance. To address this shortcoming, we propose to use a fast estimation of local motion vectors from the monogenic signal. This monogenic signal, in a nutshell, is a 2D generalization of the 1D analytic signal. In the same way that the magnitude of local phase information can be extracted from the analytic signal, the 2D phase vector can be extracted from the monogenic signal. Take for example a video sequence that contains both pulsating and translating structures. By computing the phase vectors of two consecutive frames, we can estimate the complete local motion vectors using a first-order linear approximation of changes in local phase for every pixel in the frame. Applying radial distension modeling to the obtained vector fields reveals the center lines of structures that are pulsating and not translating. In conclusion, we have shown that by estimating the local motion vectors, we can model the radial distension of vessels more accurately, and that this model yields more accurate segmentations compared to our old approach. Furthermore, by reconstructing the monogenic signal, we can approximate the local motion vectors with negligible change in the runtime of our method.